Recent story, Journal de Montréal. This is something I'd not heard about in a long, long time. I remember post-COVID, when nurses, of course, they were our guardian angels. And then as time went on, we found out fewer and fewer were coming back to work. Then we know the whole issue with healthcare in this province and the government. Although typically the discussion has been about doctors, right? Most recently and medical specialists. Nurses have not really sort of made the news headlines. And then you read this story that says 4,500 nurses were on leave from work last November due to either professional exhaustion or due to injury, which makes you sit back and go, why are we only hearing about this now? Has the government been aware of this? What's being done? Let's try to find out. Jennie Rhee is head of the MUHC Nurses Union. She is on the line. Jennie, thanks so much for being here this afternoon. Look, the number is staggering. So let's begin with that first overall. Is this gradual? When did we begin to realize something was up here?
Oh, it's been decades. It's been a long time, Aaron, that it's been an issue with people going off on sick leave. There's a tremendous amount of people who are getting injured. There's a lot of, psychological burnout as well. It's related to the physical. We're just overworked, and the workload in itself is, like I said during our nego, we were talking about our working conditions, and it's just not tenable. It's not. You can't do it day in, day out for forever and not have these consequences.
All right. Well, so you mentioned negotiations. As I said, lately we've been talking about doctors and medical specialists and their negotiations with the government. Where are you in negotiations with the government as far as nurses are concerned? Because this was a bigger story about a year ago. Has anything changed?
So we finished our negotiations and we accepted the collective agreement, and it's, the next one is going to be in 2028. We're far from that at this moment. However, since signing our collective agreement, the working conditions have not gotten any better. We've been saying it for a long time. We are about to embark on something that's called the Ratio Project. We've been wanting to do this with the government for decades. We really are pushing hard, especially before the next negotiations, to make this a reality. It's a reality in certain parts of the country, even in British Columbia. We have it in California. We have it in Australia. And those are our success stories where you have clear ratios for patient to nurse, that it's safe, and the quality of care just goes, it's just great.
Can you explain that, though, in terms of ratio, X number of patients per nurse? What do we have now? How would that change?
Well, I can only compare it to my working experience. And, like I said, a long time ago when I started in the 80s, my nurse-to-patient ratio, and I worked always in pediatrics at the Mental Children's, it was basically 1 nurse to 4 patients. Today, we see normally 1 nurse to 6 or 8 patients. It's that bad, so it's doubled. But we need to do even more work. We need to evaluate. We need to assess. The acuity of the patient should have a direct correlation with the ratio of the nurse-patient. So, in other words, if your patient is very sick, then it can very well be in an ICU setting a 1-to-1, 1 nurse per patient. If your patients are less sick, it could be maybe 3-to-1, it could be 4-to-1. But we want it enacted into law so that the government can't just say, well, sorry, we have a lot of people off on sick leave, we're not replacing them. It's a perpetual treadmill that we can't get off, because one thing exacerbates the other. The more people you have off, the less help you have on the floors, and the more exhausted people are.
But see, if this has been going on, as you said, off the top for decades, and you have a deal with the government now, one would assume that the deal would prevent, or at least, work to prevent this from continuing to be the case. You're describing a situation where it's not, though.
Well, we're falling on deaf ears a bit. Santé Quebec, as you know, we don't like it. It's just created more bureaucracy, more headache. They want to centralize everything. They want to standardize everything. I mean, the things that we've enjoyed at the MUHC, we're seeing less and less of that, because they want us to become at par with the rest of the province. And I'm not, with no offense to the rest of the province, it hasn't been optimal in many, many areas. And what we're doing right, instead of using us as an example to make things better for the rest of the province, they're bringing us down and saying, just keep up with the rest of them. So it's a situation that I don't understand where we're going, but we definitely want solutions, okay? And right now, nurses, healthcare workers, respiratory therapists, clinical perfusionists, we're all exhausted. We've been saying this before. I spoke to you many times during our negotiations. We're just exhausted, and our working conditions was up there with our demands in terms of, our better. We wanted better. It was up there with salaries. And so far, we're not seeing it.
I wonder as well, because, I preface this by saying we hear about doctors and medical specialists. Obviously, the fact, and we all know this because we've been talking about it for so long, there are still people who can't get a doctor. That number is over 1 million people in the province of Quebec. With respect to nurses and shortage in the system, do we have a number for how many nurses we are short?
Well, they were saying we were already short about 4,500. Add to that 4,500 already off. So that's not a good mathematical calculation where I come from, and it's horrible. It's not good. It's really not good. For us at the MUHC, I can tell you we have roughly 275 active invalidity files, which represents for us about a 6.7% of our membership. 6% is too high. Okay, we want to make it better. If you improve the working conditions of the employees, I promise you will see that number come down.
Let me ask one other thing. In the story that I read, and I'd never thought of this, and it's interesting because just the other day, we heard about hospitals now putting in metal detectors in some cases because there have been people who've been attacking medical staff. This is quoted in this article as well. Employees, nurses who were injured by a patient. Has this become a huge issue as well?
It is a huge issue. We have the McGill General Hospital where we have a huge psychiatric component. Families are also very agitated when they're waiting 20 hours plus to get their child seen. So yes, we've had security guards installed at every entry point of Emerge, and they've had to intervene. We've been attacked. We've been verbally attacked. We've been physically attacked. It's absolutely insane what's going on the floors today.
So I would ask you something simple, Jenny, like what's the solution here? I mean, you had a deal. We might have expected that given you fact that you have a deal with the government, things might have gotten better. Clearly they haven't. Where do we go from here?
I think, honestly, Santé Québec was not a good idea. I think that, when you take proximity away, the way things are managed, you need to bring it back to the local institutions. Let us manage what we do well. Let us communicate with our higher-ups, with HR, with the managers, and let's work together to make this better. The population of Quebec deserves a health care that is safe and secure and the best quality for life. That's what we're aiming for. I'm not sure where we're going, Aaron, but it's costing a fortune. Now we're under budgetary restraints, so now it's budget. We're not meeting our budgets, and it's that as well. I understand that we have a capacity as taxpayers, what we can and can't do, but at a certain point, what's important? What is your value? Is it the safety of your loved ones, the health care of your loved ones, or is it going to be, meeting numbers that we can't meet?
Someone, as we're discussing this, someone just texted in saying, Aaron, I think you should know it is the same situation in social services. The leaves of workers is tremendous. People leaving that system too.
Yeah, education as well. Teachers are burnt out. We're all burnt out. I don't know what it's going to take. It's going to take a government that's going to listen to their population.
Have an election coming up in October, Jenny. Jenny, I thank you so much for the time, and I wish you good luck, and thank you for the work that you do and all the nurses do.
Thank you very much.
Appreciate it. 316. Doctors, nurses, it's just one big mess. I haven't heard anyone say, on the ground, that they think Santé Québec is doing a good job. Not a single person, not from any of the people we talk to.
Canadian women are looking for more out of themselves, their businesses, their elected leaders, and the world around them.
And that's why we're thrilled to introduce the Honest Talk podcast.
I'm Jennifer Stewart.
And I'm Catherine Clark. And in this podcast, we interview Canada's most inspiring women.
Entrepreneurs, artists, athletes, politicians, and newsmakers, all at different stages of their journey.
So if you're looking to connect, then we hope you'll join us.
Listen to the Honest Talk podcast on iHeartRadio or wherever you listen to your podcasts.